National Doctors' Day is being observed across the country today to honor the contribution of doctors for their dedication, compassion, and invaluable role in strengthening India's healthcare system. The day is celebrated every year on 1st of July to commemorate the birth and death anniversary of legendary physician and former West Bengal Chief Minister Dr Bidhan Chandra Roy, whose contribution to medicine and public service continues to inspire generations. Now, this year's theme is Behind the Mask, Who Heals the Healers. This highlights the importance of supporting the mental, emotional and physical well-being of doctors who serve on the front lines of healthcare. Prime Minister Narendra Modi has extended greetings to the doctors across the country. In a social media post, he said that their hard work, compassion and commitment form the backbone of India's healthcare system and have earned the trust and gratitude of millions. The Prime Minister has also highlighted India's significant progress in strengthening the healthcare ecosystem over the last decade, noting that the number of medical colleges has more than doubled and medical seats have expanded substantially, creating more opportunities for aspiring doctors. He added that under the vision of Viksit Bharat, doctors will continue to play a key role in promoting preventive healthcare, medical research, innovation and accessible treatment for all. Now, Union Home Minister Amit Shah has also extended his greetings, praising doctors for their role in promoting good health, awareness and a stronger society. Meanwhile, Nagaland Chief Minister Nephew Roy has also played his tributes, acknowledging the selfless service and compassion of doctors in improving lives every day. So overall, the day is being marked nationwide with tributes, events and messages of gratitude towards the medical community. Well, let's go across to such frontline warriors. Dr. Kaushal Banerjee, senior homeopath, and Dr. Kalyan Banerjee's clinic, and Dr. Swarupa Mitra, senior oncologist, are joining us on this broadcast. First of all, doctors, thank you for your service. And today is a day where we celebrate, you. We thank you, we express our gratitudes, but I want to understand how are you looking at the theme of this year's Doctors' Day, which is the mental, physical and emotional well-being of of doctors, of these frontline warriors who are constantly on the job trying to raise a healthy India. Dr. Kaushal Banerjee.
Well, it's a very, very important theme to what is annually celebrated as the National Doctors' Day, and I'm very glad that this is being highlighted. In this country, particularly, we find that doctors are overburdened with high volumes of work, and this ultimately affects their health. But I think more importantly, it affects the outcomes of their treatment, which should be of most concern to everyone, whether at a policy level or at an employer level or even at the patient level. A well-rested doctor who has time out of work to take care of himself, to recultivate his own relationships with his family and loved ones, will be a better doctor. We also know that things like mental and physical well-being help in memory, recall, focus, analytical thinking, decision-making. These are critical skills that the doctors rely on every day, whether you're examining a patient in the OPD, conducting a surgery, or just listening to the patient. Mindful listening is a very important component that comes from a calm, rested mind. So all of these things, all of these outcomes will improve if we take care of our doctors, if we build systems that allow doctors to rest, flourish, and come back and be better physicians.
Right. Let me also rope in Dr. Mitra into this discussion. Dr. Mitra, I want to understand from your perspective as well, what are the measures that can be taken to ensure, like Dr. Banerjee pointed out, a well-rested doctor, somebody who can perform to 100% of his ability. So what are the measures that can be taken for the well-being of the doctors?
Okay. Good morning, everyone, and wishing all my colleagues a very happy Doctors' Day. And also, I pay my regards to Dr. Bidhan Chandra Roy, who had been a legendary physician and also the past Chief Minister of West Bengal. But saying all this, I agree absolutely with Dr. Kaushal Banerjee, and I think all of us will agree that the burnout, which we call as a mental stress, is a glaring problem. Why does it happen? Yes, we all know this, but we have to understand the reasons behind it. Whatever Dr. Kushal has said, I agree fully with it. I could not agree more. But other than that, also there are a few more factors. So one is we are looking at patients, we are seeing patients, and the amount of the number of patients, especially in the government hospitals, are huge. If we look at the doctor-patient ratio in India, it is 1:11,080 doctors, whereas the WHO guideline is 1:1,000. So look at the amount of patients we are handling. Other than that, we have to look at a lot of administrative side of it, a lot of writing, a lot of non-clinical work, which probably can be done by someone else. Other than that, there is a lot of pressure of work, be it in the government hospital or in the private hospital. There's a lot of pressure over there. Are academic pressures also. We have to keep ourselves updated with whatever is happening. The F ourselves well-read, our knowledge should be perfect. The emotional burden is a lot because we are dealing with patients. People think that we are not affected. Of course not. We lose a patient. It is every day, it is the same pain, whether we have 20 years of practice or 2 years of experience. It is the same pain we go through when we see a patient die. So what can be done? One thing which I like to mention here is about our residents, our junior residents. So you being in the media, you must go and see the condition they are living in, the amount of work they are doing, 36 hours, 46 hours in a stretch. And each per doctors, the number of patients they see, most of the times they don't have anything to eat. Most of the time they are sleep deprived. So what kind of condition, and most of this they can't even see, they can't even talk about it, because what they think is that let me finish 3 years and let me get off from here. But why should they think so? They have to enjoy as they work. They should enjoy the work they're doing. Go and look at their where they stay in the older hostels of the government hospitals. It is inhuman condition they are staying in. How do you think they can perform? So, and also the lot of toxicities in the work. I think we should focus on these two. So what you have asked me, what can be done? Yes, from our side, we'll try our best to balance the work-life balance, which is next to impossible. But what the government can do, what all of the others can do, is give us a good, respected working atmosphere, especially in the government hospital. I'll keep on mentioning because they are inhuman conditions. They're working. My daughter is doing her MD in a government hospital. So let us all help them live in a better general condition. Let somebody decrease our workload, at least the non-clinical workload. They can be decreased so that, and of course, most of the like private hospitals, we have gyms and other things, but the government hospitals, they don't have. So if we can provide them with that much, then we are going to do much better. We are already giving our best, but with these advantages, with these little benefits, which we deserve, probably we can give our very, very best. So let's hope next year when we meet on a doctor's day, we are in a happier condition and we can talk much happier about much happier things.
Absolutely, ma'am. Those were some very wise words. Let me also rope in Dr. Banerjee for one last word on this discussion. Or Dr. Banerjee, I want to understand what's the one message on Doctors' Day that you want to give to aspiring doctors and also to your colleagues today?
I think there is a perception that unless you are sleep deprived, unless you're constantly exhausted, you are not a good doctor. Taking time off for yourself is a very selfish act. Please don't believe this. Please don't follow this. Taking time off for yourself is a selfless act. You come back better for your patients. And working hard is very important, but taking care of your health so you can keep working hard way into your senior years is as important.
All right. Thank you so much, Dr. Kaushal Banerjee and Dr. Swarupa Mitra, for joining us